So let's talk hip mobility. And the mobility is how the bones move within one another within the joints, not flexibility with how mobile the muscles are. So hip internal rotation is a common range of motion that we lack and that we're missing a lot of the time in regards to hip pain and pelvic floor dysfunction. So I want you to get into a 90-90 position is what we call this. So hip, knee, and ankle somewhere around 90 degrees. Some of you might have to lean off to the side right here because it's going to most likely pinch or feel some symptoms in through here. You shouldn't have any cramping, sharp pain. That's way too much. So if this is painful to you, I don't want you to do it. You can tolerate it. I want you to do this. All right, so we're going to eventually try to bring our torso where our chest and our belly button are facing forward, and you can just try to shift your pelvis onto your femur, okay? So what I'm doing is I'm coming off the leg bone. Now I'm moving my torso, my pelvis onto my leg bone, which is going to be hip internal rotation for your back leg. Okay, so this is a great one to start to increment into. If you need to lean off of it and get into there, you can. So start leaning off. Can we lift this back leg up? Okay, some of you might have a severe cramp in the back of your hip, and that's okay. That's just something you're not quite ready for yet. So start with just stabilization first. If you need to come out of it, come out of it. I started to need to come out of it. And we can switch sides. So now we're going to do the other side. And am I able to shift over onto this side a little bit more? Or are you still over here? Okay, so this is going to be something you can do switches for mobility, and we can come in and out of hip internal rotation, right? So we're starting to bring, this is the leg that's turning internal. As I turn this way, we're turning it into the hip. That's internal rotation. So we need to start getting a little bit more mobility out of your hips and not only flexibility. Let's make sure our joints are also moving well. This is a big part of the underlying cause of why you're having your symptoms.